So Jess presented with a tight chest, and she said that she had been running prior to this. Um, that is when she got a tight chest. She said that she was short of breath after she stopped running, but but she had normal breathing when I was there, so it had subsided over time, which is good. Jess also, she could have possibly been presenting with asthma. However, I did ask her if she had any ventilators or any medication to help with a condition such as asthma, but she didn't have any. And she also, when I was auscultating her lungs, I couldn't hear any wheezes or any abnormal sounds, and she was only short of breath for a short period of time. She could have also been presenting with bronchiolitis, but again, when I auscultated her chest, I didn't hear any abnormal sounds like wheezes or crackles, but she only had a tight chest, which she was presenting with from the onset. She also could have been presenting with pneumonia. However, she had no cough, and she also didn't have a fever or chills, because I did feel her skin and her temperature felt normal to me. She wasn't too hot, she wasn't too cold. Also, her colour was nice and pink and rosy, and she wasn't pale. Again, I didn't hear any wheezes while I was auscultating her, and she had no prior past medical history that could indicate that she could possibly have one of these conditions. So what I was thinking is she could have just pulled a muscle while she was running, because she did say that she hadn't exercised for a while, for a long period of time, and she decided to do a more intense workout when she was running. So she possibly could have been breathing quite fast while she was doing this, as she was trying to get more oxygen into her lungs, which could have caused the tightness in her chest, as she is not used to doing an intense pace as to what she was doing today. She also said that her pain scale was a 2, so it wasn't a very painful thing for her. It was probably just quite an annoyance, and which she could have been feeling. So what I was gonna do, I was gonna get all of Jess's details, so her name, her number, where she lived, and her age, and also from the findings from the assessment that I did, I would make sure they're all documented and down on a piece of paper or on the EPRF. What I would also do to Jess is I would inform her on alternative treatments, or if she could go to a GP, or if she could go to the White Cross, rather than going to the hospital, as she is not really presenting with anything extreme. Yes, it is a tightness of chest, but she only had shortness of breath for a short period after exercising. She has I was listening to her lungs, she had no abnormal sounds which I could hear. She has equal air entry and chest rise and fall. She also has no trouble speaking full sentences to me, showing that she's not having any trouble with her breathing. She was also quite calm when I got to her as well. But there is still the option of going to hospital if she wants to go. That is an option, but it's whether she chooses to go to hospital or go to the GP or to a White Cross to just figure out and get some treatment for her tightness of chest, which is her chief complaint that she had been presenting with when I first got there.